The fear we all share. Hello and welcome back to our channel, where we talk about living our best, safest, and healthiest lives. Today, we need to discuss a topic that holds a deep fear for many of us, especially those who live independently. It's that 2 a.m. scenario. You wake up and something is terribly wrong. You feel a pressure in your chest, a strange ache in your jaw, or a sudden cold sweat. You're alone and your first thought is, am I having a heart attack? That moment of panic is terrifying, but I am here to tell you that panic is not a plan. A plan is what saves you. What you do by yourself in the next few minutes before an ambulance can possibly arrive is the most critical part of your survival. We're going to walk through this step by step. No myths, no coughing cures, just the 7 medically proven, life-saving actions you must take. And the first one starts before the attack even happens. 1. Know the silent symptoms. Of first step to surviving a heart attack is knowing you are having one. And for many of us, especially for women, it does not look like what you see in the movies. It is not always a sudden, crushing, chest-clutching event. Let's think of Margaret. For 2 days, she felt profound fatigue, as if she had the flu. She was nauseous and felt a dull, persistent ache in her jaw and upper back. She dismissed it as sleeping wrong. She was not having chest pain, so she didn't worry. What Margaret was experiencing was classic, a typical symptoms of a heart attack in women. Your heart is a muscle, and when it's in distress, it can send pain signals to all sorts of unexpected places. Please, engrave these symptoms in your mind. Pressure, squeezing, or fullness in chest. It may not be sharp pain. Pain in one or both arms. This can also be in the jaw, neck, back, or stomach. Shortness of breath. You can have this with or without any chest discomfort. A cold sweat, suddenly clammy and cold. Nausea, vomiting, or indigestion. This is why it's so often mistaken for a stomach issue. Sudden, extreme fatigue, or dizziness. If you feel a combination of these things, especially if it's new and unexplained, you must act. You are now on the clock. 2. Life-saving step 1. Call emergency services first. This is the most important step. Before you do anything else. Before you call your neighbor. Before you call your son or daughter. Before you wait and see. You must call for help. In the U.S., that's 911. In the U.K., it's 999. In Australia, it's 000. Every minute that passes, more of your heart muscle, starved of oxygen, is dying. This is what doctors mean when they say, time is muscle. You cannot get that muscle back. Arthur's story is a cautionary one. He felt that classic pressure, but he felt embarrassed. What if it was just indigestion? He told himself, I'll wait 15 minutes. Those 15 minutes of delay, of not wanting to be a bother, caused irreversible damage to his heart. The paramedics and doctors have one wish, that you would call them sooner. Do not drive yourself to the hospital. You could lose consciousness at the wheel. Make the call. State your location clearly and say, I think I'm having a heart attack. 3. Life-saving step 2. Chew 1 aspirin, if you can. After you have hung up with emergency services, your next step is to get an aspirin. This is not a painkiller. It is a powerful blood thinner. A heart attack is most often caused by a clot blocking an artery. Aspirin works by helping to break up that clot and prevent it from getting bigger. Here's the critical part. Do not swallow it with water. You must chew 1 full-strength, 325 milligrams aspirin or 4 baby aspirins, 81 milligrams each. Chewing it allows it to be absorbed directly into your bloodstream through the vessels under your tongue, getting it to work in as fast as 5 minutes. Swallowing it can take 30 minutes to work. This comes with one crucial disclaimer. Do not do this if you are allergic to aspirin, have a bleeding disorder, or if your doctor has specifically told you never to take it. But for most of us, having a bottle of chewable aspirin on a nightstand is a life-saving, non-negotiable part of our emergency plan. For life-saving step 3, unlock your door. You are alone. You have called for help, and it is on the way. You have taken your aspirin. What is the next physical barrier to your survival? A locked door. Paramedics lose precious minutes, that muscle we talked about, breaking down doors to get to patients who are unconscious on the other side. After you've made your call and taken your aspirin, This is the one and only time you should be moving. Walk calmly to your front door. Unlock it. If you have a chain, unlatch it. If you have a storm door, unlock that too. Then go and sit down immediately. Robert's story haunts me. He made the call, but collapsed in his hallway. He was conscious when the paramedics arrived, but he was too weak to get up. He could hear them on the other side of his door, shouting, and then the terrible crash as they had to force entry. Unlocking that door is a profound act of self-preservation. 5. Life-saving step 4. Stop all movement and sit down. Your heart is in crisis. It is screaming for oxygen. The worst thing you can do is ask it to do more work. Do not pace the room. Do not try to clean up or get ready for the ambulance. Do not get a glass of water. Do not try to find your cat. Your only job is to become as still as possible. Any physical activity, no matter how small, increases the heart's demand for oxygen. This is like trying to run a marathon on a broken leg. You must stop all movement. This brings us to how you should wait. 6. Life-saving step 5. Get into the heart-safe position. Do not lie down flat. Lying flat can make it harder to breathe, especially if fluid is beginning to build up in your lungs, a common complication. Instead, you want to be in what we call a position of rest. The best position is to sit on the floor with your back supported by a wall or the front of a sofa. Bend your knees and, if you can, prop your head and shoulders up with a cushion or pillow. This W position, back supported, knees bent, helps reduce the strain on your heart and makes breathing as easy as possible. It keeps you safe if you become dizzy, and it's a comfortable position to wait in. 7. Life-saving step 6. Focus your mind and breathe is maybe the hardest step of all. As you wait, your mind will be racing. The panic is real, and it is a biological response. But here's the dangerous part. Panic releases adrenaline, which makes your heart beat faster and harder, increasing its demand for oxygen and making the damage worse. You must actively fight the panic. You have done everything right. You've made the call. You've taken the aspirin. You've unlocked the door. You are in the heart-safe position. Help is on the way. Your job is now a mental one. Close your eyes. Try to breathe slowly, in through your nose and out through your mouth. Count your breaths. Say a prayer, recite a mantra, or just focus on the sound of the clock. This is not just a way to pass the time. It is an active medical intervention. By forcing your body to breathe slowly, you are telling your nervous system to stay calm, keeping your heart rate as low as possible. You are actively participating in your own survival. The 7th tip, prepare tonight. This brings me to the real 7th tip, which is preparation. The time to think about this is not during the event, but right now, in the calm of this moment. Put that bottle of chewable aspirin on your nightstand. Put the emergency number 911-999-000 on a large print note on your fridge and by your bed. Tell a neighbor where you keep a spare key or consider a lockbox for emergency services. Mentally walk through these steps so they become your automatic plan. A plan is the antidote to panic. Knowing these steps transforms you from a victim of an event into an active participant in your own rescue. We know this is a frightening topic, but talking about it is how we empower ourselves. Have you created an emergency plan for your home? Do you have any other tips for staying safe while living alone? Please share your thoughts and wisdom in the comments below. Your idea might be the one that helps someone else. If you found this video valuable, please give a thumbs up, subscribe for more essential health advice, and please share this with anyone you know who lives independently. Sharing this video is an act of love. Thank you for watching, and be well.